Welcome from the Center of Excellence for Health. My name is Deneen Diamond. I am the lead here at the Center of Excellence, and we have a super exciting guest here today. It's our second day of Allied Health Week. We took a little break yesterday because I was busy with provincial meetings, but today we are back and we have a session at 10:30 and 1:30. And today's session is all about hospital pharmacy technician. So we are very excited to introduce you to Shauna Curtis, who works at Horizon Health Network. And she is going to speak about her passion and her excitement for her job, and also how she got there. So we are so excited to have North and South Esk Regional Grade 7 here today with us. And thank you so much for attending. We really hope you enjoy the presentation, and there will be time for questions at the end. So without further ado, I'm handing it over to Shauna.
Perfect. Thank you. As Deneen mentioned, my name is Shauna Curtis. I'm a registered pharmacy technician with Horizon Health Network here in the Fredericton area. And I'm just going to start the presentation with a couple questions. Are you interested in a career in healthcare that is challenging and rewarding? And did you know that there's a pharmacy in the hospital that provides medication to patients? And the reason I ask this question is because I'm often met with blank faces when I tell people that I work in a hospital pharmacy. They have no idea that it exists. Now, mind you, it's not available. If you came into the hospital, it's not something you could access as a member of the public. But we're here to provide patient care to the patients here in the hospital. So this presentation will describe a typical day as a hospital pharmacy technician and explore the education options that are available in New Brunswick. And I also just want to note, I'm focusing on hospital practice, but for your awareness, there are careers in the retail community pharmacies for pharmacy technicians. And I'm going to use the term retail and community pharmacies interchangeably throughout the presentation. So that means retail community pharmacies are like your Shoppers Drug Mart, your Superstore pharmacies, Walmart, etc. So here is the agenda for today's presentation. So again, if you have any questions, feel free to stop me. It's pretty casual, not very formal. So, just relax and just let me know if you have any questions. So a little bit about, oh, sorry, technology. A little bit about me. Well, first of all, this picture is old. I obviously should update it with, the current hair color, glasses, etc. So I've been a pharmacy technician for 25 years at Horizon Health. I actually just celebrated my 25th work anniversary last week. I tell people I started when I was 12, but nobody really believes me. But the truth is I started when I was 19. So you can do the math to figure out how old I am. Oddly enough, I always wanted a career in pharmacy. My older cousin is a pharmacist, and I looked up to her when I was growing up. So, when I was in high school, I was in a co op program, and I remember my two career choices were pharmacist or lab technician at the potash mine. So, I grew up in Sussex, where the potash mine was fully operational. And I can't remember the circumstances, but I ended up at the lab in the mine, and I always enjoyed a career in science and math, so that field, seemed natural to me. So during my placement, I loved the lab work, and I applied to the chemical technology program at NBCC St. John's, so the New Brunswick Community College. And you know what? I absolutely hated the course. It was so hard, and it wasn't like anything I experienced working at the mine. And I failed the first semester, and I had to move back home. So that left me really discouraged. However, it did lead me on the path to the pharmacy assistant program, also at NBCC SJ. Now, you may have heard me mention that I'm a pharmacy technician. The program I took is a pharmacy assistant. I will explain in a little bit what the differences are. And I don't regret my decision. I tried something that I thought I would enjoy, but it wasn't what I expected. And I also knew that I was not cut out for most healthcare careers, especially any of those with hands-on patient care. I do not handle the sight of blood or deal with bodily fluids. Just a quick story. When I was in the pharmacy assistant program in St. John, I had a few girls that had taken the medical laboratory technician course. So those are the people when you come into the hospital and they take your blood from you. Those are the technicians that do that. So I had a few of the girls that took that course and then moved on to pharmacy. And we were just sitting at the lunch table talking about the course, and they were talking about how they practiced drawing blood on one another, and I passed out in the bathroom at college. So again, I knew that that career was not meant for me. However, I do have a massive respect for nurses, LPNs, patient care workers, or anybody working with that direct hands-on patient care. Uh, and during my career, I've had a few mentors that I relied on for advice and guidance. And having a mentor has helped me reach my goals. So, for example, when I graduated MBCC, I was a pharmacy assistant. And after a few years, we were grandfathered to the title pharmacy technician. And then around 2009, 2010, it became a regulated profession. Uh, and it became a regulated profession, but each province had to decide how they were going to handle that. So I had to make a decision whether I wanted to continue as a pharmacy assistant or if I wanted to take extra courses and write exams to bridge the education gap and register as a pharmacy technician. So there are a lot of unknowns. The thought of taking courses and studying and writing exams was really scary because, I had been out of school for almost 15 years. So I turned to my mentors for advice. They helped me with encouragement and support. I didn't want to miss any career opportunities down the road that may not be available to pharmacy assistants. A couple personal skills. So in my spare time, I do enjoy baking and reading. When I'm baking, it has many similarities to one of those skills that we use as a pharmacy technician called compounding. So if you need a medication, but it's not something that you can purchase or that you can get from a manufacturer, and a lot of times it's for neonatal or pediatrics. So, our little tiny babies, and our our kids, we will actually mix ingredients together, which is called compounding. They have very specific recipes and techniques that you must use, which is very similar to baking. So when I was creating this presentation, I was trying to think of hobbies that align with my job. Although I no longer compound or prepare injection medications, I always enjoyed those areas because they're very similar to baking. Both baking and compounding require exact measurements of ingredients and specific technique for mixing and preparing. So, if you don't mix your cookie batter properly, your cookies aren't going to turn out and nobody will want to eat them. If you don't mix your compound properly, it may affect the patient's treatment and how much medication they receive. So, you really want to make sure that you follow the directions and make them exactly as they're laid out. And I also enjoy reading. Always have a book on the go. Generally enjoy fiction. However, occasionally I do enjoy autobiographies. So here's this slide is going to talk about, my role and what my typical day looks like. So my current role is the pharmacy information system technician. I'm responsible for implementing and maintaining the pharmacy applications, so the computer software and systems that we use, and the associated equipment. So I've been in this role since 2006. And I have pictured here two pieces of equipment that we use on a daily basis. So the top picture is something that's called a PackMed. So we use this piece of equipment to repackage medications to dispense in individual packages to the patient. So we would we would put a bottle of pills into this machine, and in turn would give us strips of medication. So it would take the 100 pills in the bottle and give us 100 individual packages. And then the bottom is what we call an automated dispensing cabinet. And that's used on the nursing units for dispensing medications to the patients by the nurses and LPNs. And that's something that, as pharmacy technicians, we're responsible for restocking every day to make sure that they have the medications they need on the unit for the patients. So, um, and as I previously mentioned, I always wanted a career in pharmacy, but I took a little detour before I started my journey. The pharmacy assistant program seemed like a good starting point because I really wasn't, sure if I wanted to go to university, and I wanted to remain close to home. When I graduated in 1998, I started working at a local retail pharmacy for a few months. Then I started at the hospital in a casual position. And all that means is that I didn't have a permanent job, so I didn't have guaranteed hours. So it was a call in basis, which is typical for when you start in a hospital practice. So generally, when you start in hospital, you're trained in common areas like medication dispensing, so using the PACMed machine pictured at the top, restocking and replenishing medication on nursing units, which is the automated dispensing cabinet in the bottom, compounding, which I mentioned in my previous slide, and compounding involves non-sterile compounding, which are things like liquids and creams, and also order entry, where we enter medication orders written by the physician or doctor in the computer system. So um, there is an opportunity to move on and train to our more specialized areas, to sterile compounding, which is where we would prepare intravenous medications, so medications that they put through an IV, in your arm, or chemotherapy. And then other areas include inventory management and then my role as IS technician. So I work independently, but I'm part of the pharmacy team and I interact daily with my coworkers, pharmacists, pharmacy technicians, assistants. I enjoy the variety of maintaining our systems and the flexibility in my schedule. Every day is different, it's never boring. But the downside is when something breaks or is not functioning properly, I'm the first person to call. So it can be stressful. Our systems are critical and important. We need to make sure that they're working properly so we can do our job effectively and efficiently. So that generally means, contacting our internal IT and perhaps the manufacturer of the equipment that we're using. And we kind of get bounced back and forth a little bit. I liken it to feeling like a monkey in the middle, where somebody's bouncing a ball back and forth and you can't catch it in the middle. That's kind of how it feels like some days because things are out of my control and I have to wait for either our IT or the company to help resolve the issue. Important skills required for my role are patience, attention to detail, ability to work independently, ability to complete required tasks with defined deadlines, and have good communication skills. Um, and I'm glad I researched the profession before I applied. I took some time and shadowed pharmacists and pharmacy assistants in both retail and hospital. So when I started the program, I had a general understanding of what to expect. And most commonly, you can get employment in the hospital or the retail community pharmacies, like I mentioned. Both areas, you're expected to work evenings, weekends, and holidays. The job can be physically demanding. You're on your feet a lot. You're walking around back and forth, and you can also get repetitive strain injuries. So I don't know if everyone can see on my camera, but when you're preparing sterile medications, you're often in a position like this. So you're sitting and your arms are up in the air because your medication IV bags are hanging in front of you and you want to make sure that everything is really clean when you're mixing those medications. So you can appreciate if you're mixing medications for a long time, you can get injuries like in your neck and shoulders. So it's just something to keep in mind. I mean, that doesn't happen to everyone, but it's just some of the potential pitfalls or downside of the job. So this slide just highlights again uh, some of the tasks that you would do on a daily basis as a pharmacy technician. So the top picture is an example of somebody dispensing medications and counting pills out on a counting tray, and then directly underneath that is somebody preparing a compounded liquid. And so part of a daily task as a pharmacy technician, you're maintaining inventory of critical medications in hospitals and health centers. We want to make sure that we have the medication on hand when the patients come and they're ordered by the physician. We need to make sure that we have that available to them, and then passing that on to the nursing units so they have that available when they need to administer it to the patient. We prepare prescriptions for patients. We mix intravenous medication and eye injections and drops. So the picture to the right is showing somebody working in the sterile IV center. So this would be a type of setup that we would use to mix, intravenous medications, the eye injections, and eye drops, etc. Um, if you're preparing chemotherapy or other specialized medications for cancer, you would have a similar, you would be dressed in a similar manner. However, the hood surface, the big box that you see that this person is sitting in, looks a lot and operates a lot different, but basically the attire is the same. So again, you're in this area for long periods of time, dressed in sterile garb. You have your hat, your mask, your gloves, your gown, you have booties on. So, um, you could be in there for several hours. And another task that we also do is review patient medication history and maintain their profile and other important records. So in terms of education and training, I know this slide might be hard to see, but so there is a pharmacy technician program now offered in English at MBCC St. John in Moncton, and also in French at the CCNB site in Campbellton. It is a 2-year program. I've also listed the admission requirements, which are directly from MBCC, but you can see that there's some, math and science components that are required. And as I mentioned, most students in the current market are getting hired after graduation, either in community or hospital. Now, when I was a student a long time ago, I applied to most pharmacies in the area and started at a local retail pharmacy for a few months, and then I was able to start my casual position here. I was casual for a few years, and then I was hired for a permanent part-time position and then moved to full-time. So that's generally the path that you need to take when you want to work in hospital. However, um, we are not immune to staffing shortages and everything that has happened since COVID. So actually, a lot of our recent staff members are getting hired into permanent full-time positions, which wasn't heard of when I started working 25 years ago. Um, so I mentioned I was a pharmacy assistant, and then I moved on to be a registered pharmacy technician. So part of that means that I'm required to pay an annual licensing fee to the New Brunswick College of Pharmacists, also NBCP for short. And licensing requirements include liability insurance, having first aid and CPR level C, and a minimum of 15 continuing education credits. So that means it's required for me to take further education to learn about things that would be pertinent to my job in order to maintain my license. So after graduation, most regulated professionals are required to complete registration requirements as outlined by their licensing body. Ours happens to be the New Brunswick College of Pharmacists. So generally, you would start that process with registering as a student with the college. And then after graduation, you would complete what's called PEBC exams, which are administered by the Pharmacy Examining Board of Canada. It's a written and practical exam, 2 exams that you need to successfully complete. You also need to write what's called a jurisprudence or a law exam, and that's administered by the College of Pharmacists. And they also require you to complete what's called a structured practical evaluation booklet before becoming registered. Now, and that's along with the other licensing requirements that I mentioned. And there's fees and there's different things, and I may have forgotten a couple things like, background check, etc. But that is very typical of a regulated professional. So in conclusion, career advice, I would take the time to research anything that you might be interested in. If you can job shadow and talk to people working in the field, the more knowledge you know, the better. Again, if you enjoy science and math, you like working with a team and are looking for something healthcare, then a career as a pharmacy technician might be perfect for you. And I did like an informal survey and asked some of my coworkers why they chose this career. And, many were like me and they wanted a career in pharmacy, but they were unsure if they were cut out for university. And then others, wanted to take a course that they could complete in a couple years and begin working right away. So, you know, it just depends on the individual. But I found it interesting that, a lot of us kind of had the same idea that we wanted to be in pharmacy. We just weren't sure what was going to work for us. So, in follow up, I'll leave you with my email. I feel free to contact me if you have any questions. And thank you for your time.
Awesome. Thanks so much, Shauna. I learned so much about your profession. That was amazing. Um, and look, I see in the chat it says, thank you. I have a lot of students interested in a career in healthcare, so this was great.
Awesome.
Miss Matchett, if you want to ask the students if they have any questions, they can certainly type them in the chat for you, or you can type them in the chat. That would be lovely. But we do have Shauna for a couple more minutes. And Shauna, you spoke about the struggles during COVID and what happened during that situation, and just really what was going on with healthcare. And can you tell us a little bit about where you are today with recruitment and retention and all of that? Is that something that is continually being maybe an issue, or has it kind of decreased, increased? What does that look like?
No, I would say it has progressively gotten worse. Like, when I graduated and, the years after that, there were lots of students out there, lots of people looking for jobs. And at one point in time, it was so hard to get a job at the hospital. Like even offering a casual position was unheard of. Like there's just not a lot of turnover here, especially in the assistant and technician pool. Obviously, I've been here 25 years. So kind of once you get here and, you can see where the different areas are that you can work in, it can be a very interesting and rewarding job. But now, a few things have happened. Again, the registration process for technicians has changed the education requirements. So instead of having a yearly course, we now have a course every 2 years. So we're not getting the same amount of students every year because they're alternating their graduation year. So, we've decreased the amount that are available. And, if you've ever taken a drive around, there's pharmacies everywhere, everywhere you turn. So the demand is pretty high at the moment. We still have currently still have vacancies. So I never dreamed that this was how this would look, all these years later. I'm still floored that people are coming in here to a permanent full-time position. It's unheard of. But um, the good thing is that if you seek these opportunities, the chances of getting a job are pretty high.
And this is why I mentioned this, is because especially for grade 7 students, it's sometimes we really don't know what avenue to go, but maybe there's some people that really do want to have a job fairly quickly after they graduate. And working as an administrator at a high school, a lot of my students would say, Mrs. Diamond, I just want to graduate, take a program, and have a job and have a
Yeah.
career.
Yep.
And this is a great example of, if that's something for you, there's opportunities right here in our province, right here in our cities. You guys are in the north. I'm sure there's opportunities up there. I know the Horizon Health Network team up there, and they're lovely. So I think that it just really does showcase that if this is something that you're interested in, or if this is a career in health that you're interested in, there are so many opportunities here for you to explore, like you said, to really research what it is that you want. Maybe reach out to some of those folks that work there and say, can I come talk
Yep.
to you? Can I interview you? I know teachers, and Miss Match, and I'm not sure if you're one of those teachers, but when I was teaching personal wellness, I would ask my students to interview somebody that had a profession that they were interested in. And I do know that that activity for students really did, one, opened up doors, but two, made connections that some of them kept for life. And it's really neat to start networking, especially at that age. So Unless there's
Absolutely.
any other questions, I have all kinds, of course, but I'm not going to hog the floor. But certainly, if this is something that you are interested in and you want to be part of, please feel free to reach out to
Oh,
Shauna. She left her email there. I'll also put my email in the chat in just a minute. All of these sessions are being recorded and listed on the Center of Excellence speaking series. So Miss Magid, thank you so much for coming. We really appreciate the grade 7 students being here. Shauna, you are a rock star. You were amazing. I can't believe you were nervous because you were unbelievable. You were super engaged, and we are so blessed to have Horizon Health as a partner. So thank you so much. And we certainly hope to have some of your colleagues join us in the future. So with that, have a beautiful day. Take time to get outside, breathe the beautiful, crisp air. I know it's cold, but it's really important for our lungs to breathe in and out that fresh air, and have a beautiful day. And I stop.